Well, it can ruin a first impression or an opportunity at a job or even love. We are talking about bad breath.
Bad breath, or halitosis, is something many people deal with, but they don't have to. Dr. Catherine Hammel's here to the rescue for us. Thank you so much for coming in.
Thank you for having me.
And so let's just get right down to it. I'm sure there's many reasons, but what's the main reason people maybe deal with bad breath?
Well, I'd say that there's two main reasons that people have bad breath. One is that they don't take care of their teeth properly at home. And number two would be that there's some other systemic underlying health concern going on that can be causing their bad breath. But it's easy, or relatively easy, if someone's got bad breath, just see if you do. The best way to do it isn't checking your own breath, because you can't quite tell on yourself. Is ask a loved one. You probably ask a kid, because they'll be very honest with you.
That's so true.
Or ask your loved one.
Yeah.
Your spouse would be the one to be like, is my breath a little stinky, or is it just me? And that would be a good way to find out.
So we're talking about, maybe poor care of our mouths and health issues. Are there any other things that can create bad breath?
Yes. Smoking would be a big one, obviously. It dries your mouth out. It makes everything about you smell. Depends on what your diet is. People who eat a lot of garlic, onions, things like that. And even the low-carb diets can cause bad breath. Sinus infections or other respiratory. I can definitely smell the difference between periodontal disease and a sinus infection.
Really?
Wow.
And what else is there?
I feel like when I'm thirsty or when my mouth is super dry, I can just tell that I need to brush my teeth too.
Exactly.
Is that something?
And being dehydrated is one of them, because having dry mouth is you don't have as much saliva, which kind of helps balance out and flush the bacteria out and keep your mouth clean. So if you don't know what else to do, rinse your mouth out with water. That'll help.
Okay. Now, when we're saying about dental hygiene, some people might think, well, I brush my teeth in the morning. Shouldn't that be enough? But there's a little bit more that needs to go into it.
Yes, everyone has different bacteria. Some have the periodontal, which is the gum disease bacteria. Some tend to have more of the cavity bacteria. And so you kind of want to cover all bases and make sure you keep things clean. So what I recommend to my patients is to brush your teeth first, to floss your teeth first, get all of the bacteria and the food debris out from in between your teeth. Then brush so that all the little bubbles get in between your teeth. And then rinse with a mouth rinse, like a Listerine or a Colgate Total, any of the antibacterial rinses. And then they also have a tongue scraper for people who feel like they have really chronically bad breath. And I recommend the metal ones that you can throw into your dishwasher a couple times a week.
Oh.
You don't have to be aggressive with it, but that can just help get the bacteria that's kind of decaying on the back of your tongue, causing bad breath, and gets rid of it.
No, okay, so I'm glad you said this, because I'm one of those people that brushes my tongue and the top of my mouth, and then I try to go around and get the cheeks. Is that normal, or am I just making stuff up here?
Well, I don't think it hurts anything, and brushing your palate, that's a part of your mouth that doesn't usually get brushed or cleaned. And brushing your tongue does help get rid of the bacteria back there.
It does.
And I know in a perfect world, if you could, have us do exactly what, you wanted us to do, we would brush our teeth after every single meal. But in reality, we all maybe don't have that kind of time, or we're on the go or whatever. So would you say morning and night is the two best times?
I know we all live busy schedules, but it's more realistic to make sure you brush in the morning and then right before you go to bed as well.
Okay.
And I also recommend the fluoride toothpaste as well.
Okay.
But in the perfect world, you'd brush after every meal, every snack. So if nothing else, like I said, just rinse your mouth out with water. It reduces the amount of sugars and food that builds up on your teeth. So if you can't brush, at least try and minimize what's in your mouth.
And I feel like a lot of people think that when you swish with a mouthwash, that takes the place of flossing. Is that true?
No.
He's like, no.
But the flossing is more of a mechanical, actually going in and removing and disturbing the bacteria. I kind of think about it as hitting like a hornet's nest or something like that. They have to regroup, rebuild their home in order to cause damage. And the bacteria in your mouth is the same way. You have to go in and disturb them so that they have to regroup and form. Or if you're just rinsing with the mouth rinse, there's different ones out there. There's ones that are more just like a breath freshener, like Scope. It doesn't have the antibacterial. Killing the bacteria is what you want to do. And so I recommend doing both so that it's kind of like you said, you get the cheeks, the palate, the tongue, just by rinsing with them.
And if all else fails and you still got the bad breath, definitely come and see you.
Yes, and if none of that's working, or if you figured out that you're not, that you don't have a sinus infection or other problems, then you may have periodontal disease, or you may have cavities that are needing to be fixed.
Absolutely. And you recommend going to see your dentist how often?
Well, it depends, but at least twice a year. Just makes life easier for everybody.
Well, this is such important information. I'm so glad you came on today to tell our viewers. Thank you.
Thank you for having me.
And to find out more about Hammel Dentistry and Dr. Hammel herself, you can call 647-2888 or log on to hammeldentistry.com.